more and more kids are being diagnosed with autism. The rate now shows 1 in 59 children is on the spectrum, according to the CDC.
Yeah, the question, though, a lot of people asking, are we getting smarter at diagnosing it, or are truly more kids living with the disorder than before? So joining us around the table to talk about it is Dr. Sabrina Fabi. Thanks for being here on this Wednesday. All right, we talk about autism a lot. It's a word that kind of gets thrown around. Tell me what autism really is when it comes to medically. What are we looking at here?
Right. So usually it depends where they get diagnosed. When a child or an infant less than 2 years old is maybe not babbling back to their parents, is not necessarily engaging in social interactions as much as what these researchers call like someone who's developing normally. And then as the spectrum continues, it is a very wide spectrum. And so somebody the same age may not only have impairment in their ability to like socially engage, but also have a decrease in their IQ. So it's not just emotional IQ, but also intellectual IQ.
Tell us what's changed over the years. I remember the public service announcements talking about, 1 in 100 or so kids, right? 100, 1 in 80, 1 in 70, it's now 1 in 59 kids. What's changed in that period of time?
So it was 1 in 68 just in 2012. And so the thought is that more and more we're able to diagnose because we have better ways to screen for the disorder. But most of this data was coming from people's educational level. And so now that we're getting more and more access to kids' educational scores and how they're performing, we're able to decode who might actually have the disorder because they're just not performing as well. And it also shows how deficient we may be at actually diagnosing this properly, even still today in 2019. But that's the reason why this study is so important, because right now the way that we diagnose autism is through a series of tests that can take between 2 to 4 hours. And if you're testing a child between the ages of 2 to 4 years of age, because the average age today by the CDC is 4 years of age when someone gets diagnosed, to engage them for 2 to 4 hours is virtually impossible. So researchers did a functional MRI study. So they basically put 40 kids, half of them had autism or were on the spectrum, half of them did not, and they presented them with certain cards, cue cards, and they were able to assess what lit up in the brain. And so the children that had some level of autism had no activity in their brain within 30 seconds of being shown certain of these cards, where those that were developing normally had normal brain function. And so the thought is that one day you can basically put a child in a scanner, and in a more objective way you can actually measure the brain activity, because we know that there's probably something happening in the brain, the prefrontal cortex right in the front of the brain, that just is not picking up normal social cue.
It kind of seems like, I'm surprised we haven't been doing that already. It seems kind of like a no-duh, like that would make sense to be able to try to measure. So, even if you just put electrodes or something on their brain to try to measure it, but
it's sometimes access to healthcare, right? Like we can't even diagnose how prevalent this condition is because we don't even have access to educational records, let alone being able to diagnose it properly. And it's because you may just have a difficulty assessing it when they're less than 2, but as they're 2 to 4, you start to see them withdraw. And so sometimes it comes on a little bit later.
Sure. So let me ask you really quickly, and this is kind of how I led into it. Do you think from your medical perspective that more kids are actually being born and with autism than we've seen before, or just we're getting better at diagnosing it and really the same amount of kids have had it as when we were all growing up?
I think the same amount of kids have had it. What we do know is that now we're just getting better at diagnosing it. There's greater awareness. And I think with all of that came out on vaccinations, we do know that now there are multiple studies to support that vaccinations do not lead to autism. But that brought greater awareness to this, people a little bit more sensitive and wanting to get their children tested. What we do know is that they get diagnosed early, then you can start intervening early. And we do know that the earlier you intervene, if you intervene at age 2 or less, the brain is more malleable, so it can respond better to language intervention, communication intervention, and IQ intervention.
All right, Dr. Fabi, thank you for the insight. We appreciate it.
Thank you, guys.